Thank you very much. Thanks, Professor Takada, and thank you very much for the invitation to get me here to Berlin to give you a presentation of mechanisms of SCENAR therapy. I'm a German medical doctor, but I do work in New Zealand, at the most beautiful end of the world. If you've forgotten where that is, it's down there somewhere. But that's the wrong map anyway. It has to look like this. That's the official New Zealand map. So, although I work in New Zealand as a naturopath and as a SCENAR practitioner, this is a photo of an average SCENAR clinic in New Zealand. That's up on the North Island, so lucky enough, we didn't get much of that earthquake up there. That happened after I left. Can't leave those guys alone. Okay, I want to talk about SCENAR therapy, and I want to talk about, well, I mainly talk about those things, how SCENAR works, in order, A, to understand it myself, and secondly, to give my clients something that they can understand, because SCENAR therapy is so different from what I have been doing in the past as a medical doctor. And I was very intrigued by that SCENAR therapy is based on many different mechanisms, that it is an individual therapy, it is an application according to biofeedback. The many protocols that we learn are just guidelines, and still the whole thing is a holistic therapy. So when I started doing SCENAR, I was gobsmacked about what it can do and hadn't got a clue how it works. So I tried to search and try to find some answers there, and I hope I can give you some sort of summarizing what I found, which makes sense, A, to me, and B, to my clients, because often they ask, how the hell can a little machine that looks like the remote control of my TV do so many good things? Well, I think you get these questions too. Okay, it does pain relief, and it doesn't matter what type of pain it is. We know it can induce healing, and nobody really can explain how that works. It works against edemas, against inflammation. It increases perfusion. This is anti-allergic, and it helps calming down the autonomic nervous system there. So how's that all working? We use SCENAR as pain therapy. We use it in general therapy if there's chronic pain or a disease associated with pain, although I've widened my indication for it in terms of any discomfort I classify as pain as well. And I use it also in the general therapy of emotional pain. Unfortunately, when I talk to my former colleagues, they don't want to know about it. Or once I start telling them something, they don't get it. They ignore SCENAR. They don't understand it, or they don't want to understand it. And sometimes I've got the feeling, and it took me a while too, actually, to change from that biochemical understanding that we have, there is a pill for every ill, to actually change over to SCENAR therapy. They want to have studies. Well, there's heaps of studies done in Russia, but then they say, oh yes, a Russian journals. Don't want to know about them. Okay, it doesn't help that the translations are a little bit wobbly, but what they want is independent studies, but nobody's prepared actually to go and do them. And if I offer this SCENAR therapy as a complementary therapy, they're not interested either. It doesn't help if I tell a doctor about SCENAR and they jump on Google and look at the advertising. Star Trek medicine is here now, pain genie, space healer, all this stuff's coming up there, and they're expecting something like this. So that doesn't help us to be taken serious, unfortunately. Let's look at the differences between what conventional medicine is and what we do. Symptoms in conventional medicine are an indicator that something is kaput, irreparable. You can't repair it anymore. That's their thinking. And the only way that the patient can survive with the condition that he has is with medication or with surgery. And of course, mind and body are divided. There's a doctor for skin diseases, there's a doctor for other diseases there, there's a doctor for the mind. They don't bring them together. In alternative medicine is a bit different. Symptoms means there's something out of balance. And yes, there might be an organ might be damaged, but if we stimulate the self-healing, we actually can get the body to repair itself. And we see this again and again, even with really bad diseases like cancer, that people actually heal themselves without doing much or doing the right thing, put it this way. And of course, alternative medicine is mind and body together. I can't treat the pain of a patient if I don't help him actually to cope with it and vice versa. Okay, when it comes to pain relief, we know that SCENAR stimulates the C fibers, and that leads to a central endorphin neuropeptide release. So that can explain how the pain is actually working. We know it might be dependent on the frequency. Different frequencies give you different endorphins. And of course, it depends on where you put the SCENAR on there. That's what we are learning in all these training courses. Location, location, location. It's most important where to put the SCENAR device, not what the settings are. When it comes to working with symmetrical zones, horizontals, and reciprocal zones, then we quite quickly lose medical trained people because they say, no, it's dermatomes. If I try to explain them why that works, there's little understanding for it. On the other hand, if you look at anatomy books, you always get this, but have you seen this in an anatomy book? No, probably not. This is segmental anatomy. All the red area that you see here are actually the innervations of the dorsal part of the skin nerve, which contain the highest amount of sympathetic fibers. Now it might get clear to you why we're working so much on the back. Not only because that we are close to the spinal nerves themselves, but the skin nerves up here. These are the ones that we want to influence in order to get a calming effect. Then we have got the biofeedback. This is a very important part. As you have heard this morning already from Misha, the impulse is actually changing, and is actually changing according to the reaction of it. No other therapy actually does that, especially not conventional medicine. You go to a doctor there, you get your diagnosis, you get your prescription, and you walk home and you either take the pills or not. But a doctor can't ascertain immediately with that approach whether his therapy works or not. But hey, we can. How is the healing happening? We know that regulative neuropeptides are actually released. And it does something to all these parameters, and we can measure this. There are actually studies being done which show that the peptide synthesis is increasing, the neurotransmitters are actually increasing, serotonin, histamine, and so on. The genome activity is actually increased, and the parasympathetic factor of the autonomous nervous system is actually more active. All these things we can study, we can look at, or has been done so, and has got all these effects there. And despite that, we are actually not taken serious. Yuri Gorfinkel has got these rates of healing that he published as floating around on the internet. I believe in them, although it's not really a study, certainly not in terms of what the medical profession would accept. But this man actually summarized the results there, and I think we can get there if we get the chance to. Okay, the effectors is increased perfusion, it's better lymph drainage, it works anti-inflammatory, all these things like redness, swelling, pain, heat, and reduced function are getting reversed, and it does changes on the cell wall, and it changes the electrolyte concentration, and thereby normalizing the redox reaction, which means that free radicals are actually better absorbed. Professor Tarakanov did a study about lipid peroxidase and actually showed that the free radicals are actually reduced. The SCENAR stabilizes the cell wall and helps the anti-antiox production, and basically tumor necrosis factor alpha is deactivated and reduces the inflammation. These are all things that a medical doctor can work with. They understand that. We just have to show that it happens in every patient whenever we put the SCENAR on, but we are not quite there. If you, though, looking at that, have read recently that the oxidative degeneration might be the main cause of cancer, and SCENAR might have a really big future. Might be, we are not there yet. I just put together all these findings there and add my thoughts to this whole thing there. I hope that helps you and your patients. So, if we look at the blood flow in tissue, then we know that neuropeptides, especially substance P, gets released and causes the vasodilatation. Hence, we've got a better perfusion. There might be the axon reflex involved in this whole thing through these mediators and help the vasodilatation, but we don't know for sure yet. It's more a theory. Allergies. I didn't find anything about how it works on allergies, but hey, if you've got a patient with an acute allergy and you use it, the SCENAR on them, there's a really great effect. It might be that neuropeptides and endorphins are actually being part and parcel of that. On the other hand, my suspicion is, but I have to say, I'm an NLP practitioner as well, so I've got probably a little bit of a warped opinion about what an allergy is. However, in NLP we say an allergy is a panic reaction of the immune system. So panic is stress, SCENAR does the opposite, it might be through that. But I have yet to see a patient with an allergy that I could not treat within 30 minutes. Very impressive when you have done this. Yeah, at the autonomic nervous system, we stimulate sympathetic and parasympathetic fibers in order to strengthen parasympathetic activity. Why is that? When you're in stress, in fight or flight mode, that's where the body is fighting, not healing. You need to be in parasympathetic in order to get a healing reaction there. And that's exactly what we can achieve with the SCENAR device. So things like the vagus nerve can be stimulated in order to get this effect. The sternocleidomastoideo muscle can be treated in order to get this effect. The sacral area, of course, where mainly parasympathetic fibers leave the spine, and of course the solar plexus in the front leg. Whatever way you choose, you get a nice calming down of the patient. If you've got a blanket and you can put your patient in there, that's an additional beneficial effect for them. When you look at the metabolism under electrotherapy, it's not a study that is done with a SCENAR device, it's a study that has been done with other electrostimulation devices, but in a frequency range and in a strength that we actually can achieve with a SCENAR device. And we've seen an increase of 300 to 500% of ATP concentration. ATP is adenosine triphosphate. That's the stuff that the cell needs and the mitochondria to produce energy in a cell. That's quite impressive. Increases the redox potential. Metabolic energy is increased at the cells by recharging the cell membrane. If you think as the membrane as a capacitator, and if you think of a diseased cell as a cell where the pH is not regulated very well, it's more acid, then the whole thing starts to make sense, doesn't it? And the metabolism in general is increased because more amino acids are actually taken through the then repaired cell membrane. So you get an increased protein synthesis. All good things done by SCENAR. When I present those things to medical doctors, it's hard to convince them. Funny part is, though, the biggest successes that conventional medicine has is actually when they use electromedicine themselves. So, best example are the pacemakers that they put in for the heart, for arrhythmias, for the brain, for Parkinson's disease. Lately, they're experimenting with pulsed electromagnetic frequencies. That's what the PEMF stands for dementia patients. So, and they put in pacemakers for gastroparesis and constipation. And lately, or I don't know whether you've seen that, paraplegic patients got an electrode implanted close to where the injury is in the spine, and a pacemaker sitting under the skin of the belly. When they turn it on, they can move their muscles. When they turn it off, they're paralyzed. So now they're experimenting with that quite a bit, and it's very impressive to see how well electricity works in conventional medicine. The other one is tumor therapy fields for glioblastomas, one of the worst brain tumors that you can get. They grow so quickly, but if you put an electric field all around the head 24 hours a day, they actually reduce the size of glioblastomas. Conventional medicine is happy if they can stop the growth. And it's always in the news, electric medicine. Why not SCENAR? Another one that came up recently is the vagus nerve stimulation. They put a pacemaker up there, close to the vagus nerve. And they do this for patients who have got with their joints. They've got a generalized arthritis, rheumatoid arthritis, things like that. And they use this actually 4 times a day for 10 seconds. The pacemaker is running and the patients are pain-free. Amazing. And who says you can't do this with a SCENAR device? Transcutaneous vagus nerve stimulation is something where some companies already start to get stimulators that you hold to the neck there in order to reduce your pain. Well, we don't have to reinvent the wheel, we just take a SCENAR. And I'm working with a few patients at the moment where I do those things regularly. Or better said, they do it themselves because I'm here. But We'll see what's coming up when I'm coming back. So that's how it's done in conventional medicine and the problems we have with conventional medicine. But SCENAR is much more than that. SCENAR works with the adaptive system. Now that's where I lose a lot of my colleagues as well. Adaptive system theory is a typical Russian thing. It's great, but it's hard to explain. I try to do this with it. Say you've got pain down here, in this projection zone. That could be directly on the skin, that could be somewhere coming from deeper, but here's where the pain is. Then the nervous system is actually producing a message up to the brain saying, here's pain. Brain comes back with a message, do this. And while this is happening, we are actually getting a few spots on the skin that react, that are somehow related to this area, but you really cannot explain it very well. Why? Because we've got reciprocal zones, we've got reflex zones. Why is that piece of skin reacting to it? However, it does. And then you get these points there, which we call asymmetries. And there's an asymmetry because it's a point of pain. And when you then think about it, that we are multitasking, okay, women can better do that than men, but we know, then there might be another point that is sort of irritated, might not be an important one. And that one actually sends a message to the brain as well. And the brain does the same thing, tells what to do, and then other asymmetries actually appear. If you see that picture, it now gets clearer why we have to find A, the asymmetry, and B, the smallest of symmetries, because that's the most important one. Sort of thinking in terms of, okay, these ones who came up first, if that might be more important than the other two. But this system theory is not very well known in the Western world. And that makes it rather difficult to explain to medical people, or sometimes even to myself. It took me a while to understand that, and to my patients. So what I'm doing in my clinic, I call it the Energy Health Clinic, I do energy medicine. Now, energy medicine is a term some doctors start laughing about when they hear it. Now, I use the definition of Donna Eden about energy medicine. Energy medicine is electrical medicine, it's electromagnetical energy, and it's subtle energies. Now, electric, electromagnetic, we understand that. Subtle is a bit more difficult, not difficult. It's the energies that we know that exist, and when we work with them, we get an effect. For instance, acupuncture. With the human body field, or we work with energy psychology, or we've got people who are healers. They know how they do healing. They emit energy through the tips of their fingers, and you can measure that. And it's quite strong at times. There are some Chinese fighting champions. They can actually release the energy through the hand without touching their opponent. They fly through the room. It's all in their hands. And you, as practitioners, you are using these energies too. You might not be aware that you have them, and you might not be aware how strong they are, and they might be amplified with the SCENAR device, but everyone who's in the healing profession has got some sort of subtle energy that they use, knowingly or unknowingly. So we're talking about electromagnetic frequencies, and then we, of course, are a bit in the dilemma of there are therapeutical electromagnetic frequencies that we use, and there are pathological ones that come from cell towers and all that stuff. So it's not very well distinguished. Where's the border? What's good for us? What's not good for us? But I think that the strength of the signal is the important part, and with SCENAR we seem to be okay. So if we say we do energy medicine and there are electrons that are moving around there, then we have to ask ourselves, how the hell are we getting those electrons to the right place? Well, when we put the SCENAR on the skin, then energy is flowing into the skin. Okay, we know it's not going very deep. However, when there's an energy flow, we also have an electromagnetic field, and that goes a little bit deeper, especially when we use pulsed electromagnetic frequency and fill the whole body with it. However, the first two we are doing with the SCENAR device. We're also putting pressure on the skin, so we do get a piezoelectric effect, which is electric again. But we need a system to get those energies to the right place. The meridian system is the prime suspect. We now know primal vascular system might be the one where it comes through. On the other hand, there are theories about it's coming through liquid collagen and it's running in the connective tissue. James Oshman comes up with this idea of a cell, and all these gray things going into it, these are actually fibrins belonging to the connective tissue that can deliver information straight from the skin, because it goes all the way into the skin, into the cell, and even to the nucleus. So, the electron that flows is a signal. It transports energy to electronegative tissues. It changes the pH, and therefore the energy to form ATP. That could be the way how the healing works with SCENAR. Add to the whole thing, though, that we have got 100 or probably 200 trillion cells, and we need about 200,000 biochemical reactions per second just to keep our energy levels up. Then, whatever you do, you will be bloody busy. However, add the same amount of bacteria to the whole thing with their own metabolism and with their own influences, and the whole thing gets a little bit chaotic and so complex that it is really bad or really almost impossible to predict what's going on in a human body when they are healthy, when they are sick, and when we put SCENAR on them. All therapies that we use have got a placebo effect. There's no doubt about it. Pharmaceutical companies always want to eliminate the placebo effect. I use the placebo effect wherever I can. If I can use the SCENAR to get a parasympathetic reaction, that's almost hypnotic, then I actually can get a patient from these brain frequency all the way down to do some changes in the subconscious mind, which is activation of the placebo effect. And then I combine this with NLP, EFT, with 5-point touch therapy, or with meditation for my patients. And if you want to know more about this one, I give a workshop later on during the conference about these and how I use SCENAR actually in that. So, what's the future about SCENAR? We still struggle often with the fact how long to treat and how often to treat. We have got some guidelines which seem to be okay at the moment. My question is, could it be faster, or do we have to work longer? Frequencies and settings, I don't think it plays a big role there. Location, location, location is more important than anything. We're always looking for therapy protocols for special symptom complexes or diseases, but I would say forget about this. Symptoms, that's what we treat. how we at the end measure how successful we are in scalar therapy, well, I don't know yet. But we will get lots of new findings. There will be lots of more studies. And with scalar therapy, we are at the forefront of future medicine. And I might be back in 10 years. I might tell you a bit more about it. But we are on the right way. Thank you very much.
Спасибо огромное за доклад. Мы с вами услышали очень много гипотез, которые как бы соединены в одно. Но, если честно, вот для меня механизмы действия сканера до сих пор непонятны. Мы это имеем, мы с этим работаем, и для нас важен конечный результат, естественно. Продолжаем нашу конференцию. Следующее сообщение у нас второе. Все, Борис Kulizhskiy, у него 2 сообщения, поэтому у меня огромная просьба сделать. Они будут короткие. Видите, сжатого такого прекрасного доклада, надеюсь. Okay, I make my reports on English. Okay. No. Первый это. Yes. No. One moment, please. Yes. Okay. My first report about some phenomena. Thank you. About the phenomena on the peripheral blues after one procedure. Okay. In the past, I make some research with native blues, usually dark field microscopy, fast contrast microscopy, and registration some interesting phenomena with improving the fibrin spicular crystallization with scanner treatment and movement of white blue cell. It's interesting, but it's not so formal and not so standard methods. Activity of phagocytes, it's interesting, but it's not standard medical methods. With phenomena of all my researches. Scanner influence acceleration regulation of peripheral blood. Scanner influence increase the mobility of white blood cells. Scanner influence enhance the activity of leukocytes. Scanner influence is likely to accelerate the status of leukocytes and peripheral tissue after exposure because the population has large variety. But need to make more formalized and standard methods. This one. We take 20 people, and I take the method of automatic blood count and manual content of leukocyte formula with standard SNEARs colored. It's interesting. Purpose is study of various changes in peripheral blood tissue type. Scanner pulse in the area of amplifiers created damage. We make it the injury on skin with standard blood taking lancet. It's a pilot. We making we signet the zones. We making injury of 2 zones and taking the blood of automatic maxicometer and making standard blood smear, the colored from Romanovsky Gibbs. After this one, we put on one of our injury the scanner device
10 minutes, and up to 20 minutes after the start of first scarification. And we take more injury with standard lancet on the point of first injury. And we make comparisons before scanner and without scanner. Why lose cell? It's an automatical, sorry, it's automatical blood count. And we get scanner and the control group. Primary, left and right. It's a little difference because it's this standard error. And secondary. Okay. The paladinus, thrombocytis. With scanner, quantity of thrombocytis increases. Next time. Play diagram. This is standard comparison protocol. And primary conclusion. The data backgrounds were primary data. It has some errors. But experimental sample with legogram, it's not so good because we not found the system inside their population of leukocytes. It's a strange results. The population of leukocytes is really different because we hasn't only good and standard patients. It's everyone. We think everyone has self reaction with population of leukocytes. We need more researches about this, but we can find inside blood some interesting correlation. Oh, it's thank you. Next time, please.
Пример для всех.
Okay. It's already. I want to show you some simple protocols for treat chronic pain, maybe for their oncological patients. I work with oncological patients. Okay, and methods for oncological patients or the family of chronic pain people must be easy to learn, easy to repeat, effective, multifunctional, and combined with strong standard therapy. The people who use this one, it's easy way. Simple algorithm with small numbers of steps, easy to repeat. It's good clinical effect, and in combination with antibiotic therapy, drug therapy. Main treatments are area and the back. It's the central line of spine and paravertebrals. Self-treatment is impossible because we need assistance. Maybe parents of patients, maybe some family or nurse, maybe or some nurse. And we need a professional device. This procedure better than we making twice a day. Main treatment area is paper and paravertebrals. Direct treatment zone is defined by simplified scheme of segmental innervation. We give to patients scheme of segmental integration, but more simplified. Okay, and for that effect, we use bound electrodes, split electrodes, and blowers. Additional treatment area should be not more than area of patients 2 palms. The end of each procedure treats 7 cervical vertebrae for 2 minutes. Average time for each procedure 15-20 minutes. More of the electrode must be constant with slow speed, and with fine sticky area need wait on him of 20 or 30 seconds. If the patient has dry skin, like gynecological patients, use liquid paraffin, like the baby oil, but not use the water, physiological liquids, electroconductive gel, etc. It's possible to use analgesic gels for battery transdermal delivery on a bind zone, but without oil before. Intensity must be switched on, high then free. The file gain must be 10. If you use a built-in electrode, set frequency 90. If you use the split electrode, use frequency 30, and use FM frequency modulations. If you use the adhesive electrode, use 30 Hz and use the FM frequency modulations. For transdermal delivery of drugs, need use the built-in electrodes and frequency 180 and intensity 8. Gain as default 10. The chronic procedure is the hazard of some more acute system. The good practice is to make with procedures twice a day. Optimal procedure durations 20 minutes, not more than 30. Move built-in electrode along of central leather spine. 5 steps, easy steps. It's easy to teach the family of patients. If we has aggravation of pain, we making the difference of which one. It's easy to teach the patients. It's easy way, and this typical system of if some painful problem localized at some segments, on the distal motor segments, you work in the involved area of pain. It's easy way and good results. Maybe not so good results if you use the scanner rulers or if you some professional doctors, but for their family of fine patients, it's so good. Thank you for your attention.
Паша, можно сейчас.
Okay. And one more. 15 years ago, we had first reports treat the horse. It's interesting. We now want to try scanner work on the horse like on humans or not. On the open source, we know the thickness between horse and human is different. The resistance of skin between horse and is different. We take the oscilloscopes, we take off a lot of some devices and go to the horse. And we treat brown horses, we treat white horses, but on the screen of device we see it's similar than the humans digits. That's a split of electrodes. Close electrodes, without close electrodes, absolutely similar. We use oscilloscope and we not found not any difference between the human and the horse. Please treat horse. We don't need to specific device. Thank you for your attention.
Уважаемые коллеги, конечно, было бы очень интересно узнать, чем болела лошадь и выздоровела она. Это детали. Теперь у меня предложение. Давайте заслушаем доклад Иосифа Семикатова и сделаем праздник себе. Будет кофе брей. Хорошо? Прошу. Полчаса просите, да?
Мы стараемся сократиться.
Не, ну я же про кофе брей сказал.
Так, как? Здесь есть мой доклад?
Нет, нет, здесь нет. Да.
Да.
Так, помощь не нужна? Смотри.
А? Да, буду говорить на русском.
Сегодня так.
Добрый день всем. Я Иосиф Семикатов, с России. Говорить буду для многих, к сожалению, по-русски. Надеюсь, меня будут успевать переводить. Я практический врач, уже давно работаю и в скэнер-терапии, и достаточно большой опыт работы в официальной медицине. Мой доклад посвящен тем, кто не так давно занимается скэнер-терапией, и у кого возникают определенные трудности в построении этапа его работы с различными пациентами. Поэтому
And these beginner practitioners may have difficulty in building their strategy and tactics. Scanner therapy is the process of protracted course treatment based on therapeutic triangle, that is the system of interaction between patient, specialist, and scanner therapist, and the scanner device that functions on the principle of feedback or dialogue. This is the therapeutic triangle shown schematically on the slide. There are three elements in this system: scanner device, organism or patient, and operator. There are objective and subjective relationships between the patient and the doctor, and there is also biological feedback between the patient and the device, and there is a multi-channel communication between the scanner device and the doctor aimed at treatment. In this system, the main objective of a scanner operator is to navigate and select the best and optimal tactic to work with the patient. The tasks that commonly cause difficulties for beginner scanner specialists are as follows. These are the questions: how to start treatment at a certain nosological diagnosis or specific state, what kind of techniques and methodologies and techniques to use in a certain course of treatment, and when and how it is best to finish the course of treatment. You have heard a great number of opinions here about the importance of diagnosis. I would like to express my opinion. Strategically, the diagnosis is important for us in order to estimate the potential of our treatment. Whether we can rely entirely on ourselves or we should invite other specialists. But as soon as we have decided that we are able to treat this patient completely from beginning to the end, then the importance of traditional medical diagnosis is not so important as the so-called active here and now complaint, which may manifest itself in pain acuteness, sharpness, character of pain. So we are more likely to ask the patient not about his or her nosological diagnosis, but we are more likely to ask him or her about what exactly bothers them. So on the slide you can see the questions that we formulate to the patient. Tell me what the trouble is, show me wear and tear, and show me what's bothering you. If we find out that the complaint has a local character, this is the best and most advantageous way for us to build our strategy. We can work either in D1 or DO modes, and all that we have to do is to correctly build the process chain that is also shown on the slide: dynamics, asymmetry, small asymmetry, apposition, cyclicity. All the stages or steps are very well described in the primary school. And the most important and crucial thing is not to overlook the additional information granted to us by the body and found on the skin as secondary signs. They are most likely to appear in the active complaint zone. Whatever attracts our attention in the active complaint zone, we must be very attentive to these signs because they can considerably enhance the effectivity of our treatment. Besides, beginner specialists very often forget about one more important moment, which we now teach more profoundly in our schools. This is the moment of active and passive functional stress test, as well as provocative testing. This is very important to determine how well formulated the patient's complaint is. It is very important to have these tests in case the patient cannot clearly formulate or localize their complaint, or they have no current complaint at the moment. As you understand, the methodology or technique are not value in themselves. The course of treatment is aimed at achieving a certain result. If the patient has come to you but he has no clearly formulated complaint or nothing bothers him at the moment of treatment, so whatever procedure you give him, he will not be able to estimate the effectiveness of treatment. But stress tests help discover a certain discomfort. The patient may not be fully aware of this discomfort, but the stress tests are aimed at attracting the patient's attention to whatever troubles them. So the aim, basically the aim of active and passive functional stress tests and provocative tests, the aim is to form the clearly formulated active complaint in the brain of the patient, and this active complaint must be functional because this is the productive for building the course. The important thing is to check and compare the dynamics only in the direction of maximum manifestation of feelings. In other words, we should very clearly formulate the questions that the patient must answer. So any manipulation or treatment must begin and end with a determination of complaint parameters and complaint dynamics before and after treatment. Then, very often there is a question about the medical procedure duration. It is very individual and it is determined according to the time necessary for the positive dynamics of the complaint. So depending on how well you can build the dialogue with the patient, depending on how well you can communicate with the patient, how well you operate with the skills you've achieved, you can get the desired results quicker or slower. The choice of strategy and tactics of treatment and formation of an effective treatment plan depends primarily on whether the problem has an acute or chronic character. There are certain differences. A healthy organism is normally in the state of homeostasis, and it is within the physiological parameters. There are certain health parameters, and there are certain mechanisms of control. These mechanisms in the body are responsible for maintaining the control. If there is a certain acute condition, so these mechanisms try to restore the balance and thus return the organism to homeostasis state. If we activate scanner at this moment and we treat the active complaint, so we just support the adaptation mechanisms of the organism, thus directing the organism's efforts into the most effective way. I will quickly repeat that acute conditions demand high multiplicity of procedures. It is best to have several manipulations and procedures and treatments during the day. And we can also prolong procedures considerably. And also it is very important to have in mind symmetrical zones, because the organism gets the information not only from the direct projection zone, but also from the symmetrical zone. Having in mind everything said, you can considerably enhance the effectiveness of course of treatment. Symmetrical zones are very important according to quite a number of research. Speaking about symmetrical zones, we should remember that there is a certain rule about symmetrical zones. Actually, this is also taught in the course of primary school. The more attentive you are to the organism reactions, the more effective the treatment is. So let's consider the situation when the organism deviates from homeostasis. The organism tries to deal with the existing problem. After several independent attempts and after several ineffective courses of traditional treatment, the organism may understand that this problem is likely to take the chronic form, and so the abnormal situation in the body in fact becomes a sort of a normal condition. And so now the organism tries to control this pathological condition, and thus the new level of adaptation mechanisms is formed, and this is basically the mechanism how the chronic condition is formed. So if we start to stimulate active complaints in the projection, so we can achieve a certain improvement in the patient's condition. But you know, the adaptation mechanisms in the body have already restructured themselves. They have already, and thus the improvement, in fact, is already a deviation from the new norm that has been formed in the organism. What does the organism do? It tries to return to the new norm, in other words, to the pathology. That is why it is very important to help the organism to get back to physiological parameters. No, sorry. Because and this explains the what is called scanner reaction. This is only my opinion, but this is the explanation of the so-called scanner reaction. When we start treating the problem, the patient may register that their symptoms have become more acute. The organism seems to be reluctant to return to the norm because it has already adjusted itself to the new norm. So the way from this chronic disease back to the norm, to homeostasis, may be quite complex when the situation was chronic. So we should clearly address the existing complaints. A chronic problem may be in the state of expressed aggravation, and in this way we practice combination and alteration of treatment on general and local zones, projection zones, reciprocal, symmetrical, reflective, and corresponding zones, in such a sequence that will give better results for the patient. But it is largely up to you to decide what to start with, to deal with the active local complaint first, and then to the general source of the complaint, or vice versa. And the parameters that are there in the device, having the chronic problem, you can also vary in quite a number of parameters that are characteristic of the device, because this is, in fact, the number of tools, and it can considerably vary the number of your strategies and tactics. If there is a chronic problem not in the stage of aggravation, in this case we have to lay stress on functional stress tests, and we should look for differences, and we should carefully examine the patient's skin in order to look for secondary signs. They are the body prompts or indications where additional treatment on the skin is needed. The main stages of patient's body reaction in the course of scalar therapy are as follows. They are initial positive effects. When you start working with the patient, you exercise impact on the body and you get the positive result due to the adaptation mechanisms that the body employs. So the complaints reduce. Then comes the stage of active scanner reactions. These are the so-called and well-known scanner aggravations, because the organism is reluctant to return to the norm. And after that, we can expect the stage of secondary positive effect, which is the main criterion for the decision of when it is best to stop the course of scanner therapy. When the patient is ready to finish the course of scanner therapy, it seems to be optimal to finish a course of scanner therapy when a stable secondary positive effect is achieved. The period of stability is normally 2-3 days. So you can let the patient go when the stability effect has been seen for 2-3 days. To conclude, any medical manipulation must begin and end with the determination of the complaint parameters and its dynamics before and after treatment. It is crucially important to create a functional active complaint in the patient's mind by means of active, passive, and provocative functional load tests. Treatment of primary signs on the skin in active complaint zone, or in case active complaint is absent at the time of the procedure, it is important to treat inactive complaint zone. Effective strategy and tactics of scanner treatment technology depends on the character of the pathological process. It depends on whether the problem is acute, chronic, in the stage of expressed aggravation, or just chronic, non-acute. The duration of a medical procedure is determined individually according to the time necessary for the positive dynamics of the complaint. Application of scanner therapy and scanner expertise principles improves the effectiveness of therapeutic intervention. Thank you very much. I've tried to do my best and not to hold your attention too much. I could give you a lot of examples, but well, anyway, thank you very much. It's been great. You're welcome to the coffee break. Okay.